Diseases of the lungs and upper airways in ruminants. The diseases are nasal hemorrhages, malignant cattaral fever, infectious bovine rhinotracheitis, bovine viral diarrhea, frontal sinusitis, laryngeal paralysis, fog fever, enzootic bronchopneumonia, lungworms, and bronchitis. The normal respiratory rate in cattle is between 15 and 30 breaths per minute. For nasal hemorrhages, it's trauma in 99% of cases. For malignant cattaral fever, it's caused by the ovine herpes virus 2. It is transmitted from sheep or from goats. It cannot be transmitted between cattle. The signs are fever, depression, apathy, as well as dyspnea and nasal discharge, and bilateral cataract. For infectious bovine rhinotracheitis, this is caused by bovine herpes virus 1. The signs are unilateral cataract and respiratory signs. For prevention, screen around 10% of the herd every 6 months and have eradication programs and vaccination. For bovine viral diarrhea, this is caused by the pestivirus. There are cytopathic and non-cytopathic strains. The signs are respiratory signs, nasal discharge, and immunosuppression. It can be diagnosed with PCR or ELISA test, and for prevention, have elimination of persistently infected animals. This is done through ear cartilage screening. For frontal sinusitis, this can happen from a horn injury, and inflammation then spreads to the sinus frontalis. For the treatment, give local antibiotics, such as oxytetracycline. And for prevention, have proper horn cutting. For laryngeal paralysis, it can be found in lead toxicosis or rabies. And for fog fever, also known as acute bovine pulmonary emphysema and edema, ABPEE, it is caused by 3-methyl-indole in adults. So for the pathogenesis, when cows are moved from a poor pasture to a good lush quality pasture, they are eating way more grass proteins and way more L-tryptophan. And this causes an increase of 3-methyl-indole. And then 3-methyl-indole gets into the general circulation and goes to the liver and lungs. In the lung, it causes alveolar epithelial damage. And then this can lead to pulmonary edema. The signs are, it usually happens 4 to 10 days after a sudden pasture change. There is no fever, but they can get heavy dyspnea and white foamy discharge. They can even collapse and die from it. For the diagnosis, there will be 3-methyl-indole in the ruminal fluid. For the treatment, give hay instead of grass and give antibiotics such as neomycin. This is because if you decrease the bacteria, you'll also decrease the ammonia, which is linked to 3-methyl-indole. And you can also give a glucose infusion and antihistamines and glucocorticoids, as well as furosemide to help with the lung edema. And limit grazing on new pasture for 10 days. And for enzootic bronchopneumonia, it can be caused by viruses and bacteria. The viruses are parainfluenza 3, adenovirus 2, 4, and 8, bovine viral diarrhea, and infectious bovine rhinotracheitis. The bacteria are Mannheimia hemolytica, Pasteurella multisida, and Streptococcus pneumoniae, and Mycoplasma bovis. The predisposing factors are stress, dust, and cold and wet temperatures. And the stress can be caused by transport, which is also known as shipping fever. This is usually Pasteurella, Mannheimia, Mycoplasma viruses. It can also be caused by low immunity due to no colostrum, or overcrowding, or parasites, or nutrient deficiencies. These will cause respiratory epithelial damage, or can lead to a bacterial secondary infection, and cause alveolar damage dysfunction. The animals can die from it, recover from it, or have a chronic disease. The signs are fever and nasal discharge. And for the treatment, you can give antibiotics such as sulfonamides and 4th-generation cephalosporins, as well as anti-serum against Pasteurella, and vitamin D and vitamin A, and for young calves, give them colostrum. For prevention, have vaccination and good management. For bronchitis and pneumonia of sheep, it's also caused by adenoviruses, parainfluenza 3, reoviruses, and retroviruses. And it can be caused by bacteria as well, such as Pasteurella, chlamydia, streptococcus, as well as parasites, such as protostrongylus. The predisposing factors are malnutrition, overcrowding, cold, and ammonia. The signs are fever, dyspnea, nasal discharge, and coughing. And in the chronic cases, you'll see weight loss and coughing.